Clinical anatomy. Clinical anatomy of the arches of foot. Okay. Absence or collapse of the arches causes flat foot. The foot is flat. Okay. It is otherwise known as pes planus. It is otherwise known as pes planus, which may be congenital or acquired. Which may be congenital or acquired. Absence or collapse of the arches is flat foot or pes planus, which may be congenital or acquired. The effects of a flat foot are as follows. Okay. The effects of a flat foot are as follows. A. Loss of spring in the foot. What? Loss of spring. Spring in the foot causes clumsy shuffling gait. Okay. B. Loss of shock absorbing function. The arch of foot has a shock absorbing function. If there is lack of or loss of shock absorption, which makes the foot more liable to trauma and to osteoarthritis, which makes the foot more liable to trauma and to osteoarthritis. C. Loss of concavity of sole, compression of nerves and vessels of the sole. If the sole of the foot loses its concavity, then there will be compression of the nerves and vessels of the sole. The compression of the communication between lateral and medial plantar nerve. The compression of the communication between lateral and medial plantar nerves. Okay, which causes neuralgic pain in the forefoot known as metatarsalgia. You of Normally there is a normal longitudinal arch of the foot. Any exaggeration in this longitudinal arch of the foot causes pes cavus. We have seen pes planus, which is flat foot, whereas here there is exaggeration of longitudinal arch of the foot is known as pes cavus. This is usually a result of contracture, plantar flexion at the transverse tarsal joint. See, at the transverse tarsal joint, this is usually a result of contracture, plantar flexion. Okay, the dorsiflexion of metatarsophalangeal joints, plantar flexion of interphalangeal joints due to atrophy of lumbricals and interossei are superadded, leading to clawfoot. Clawfoot. What causes clawfoot? Dorsiflexion of metatarsophalangeal joints and plantar flexion of interphalangeal joints. See, metatarsophalangeal and interphalangeal. In first one, MP, first there is dorsiflexion and second there is plantar flexion. Due to atrophy of lumbricals and interossei, there is clawfoot. Okay.